There we go. This evening we have Dr. Blatman with us. This is another one of our IABDM, just trying to keep your mind occupied while we're going through all this stuff with the coronavirus. And Dr. Blatman has lectured for us before, so a lot of you know him. And I'm very appreciative that he took his time yesterday and today to work with us to be able to share some stuff with us. So Hal, if you'll take it away.
Thank you very much. It's wonderful to be here. I hope to share a few things. Does anyone in the group have pain, would relate to this? I have some really interesting information on fascia. I don't know what everybody's background is, so hopefully this will bring everybody up on to speed. And I'm never the smartest person in the room. If there's a question that comes up that you need to follow what's going on, if there's a way to interrupt me, please go ahead and do that. I'm going to share my screen and do a slide presentation. There's way more slides here. Pardon? There are way more slides here than I'm actually going to review. So was that something I should hear? Okay. So understand there's a lot more slides here than what my conversation is going to be about, but the ones that we're not going to talk about, or the ones we go over quickly, will at least give you reference that you can go back and refer to. I plan to go, I don't mind going after 8 o'clock. Is that okay? Or should I plan to end in a half hour and leave time for questions? Dawn, what do you think?
You go ahead and go for your hour.
Okay. Now I just got to go start slideshow from the beginning. Oh, I have to share my screen first. Let me see if I can do that. Mute, invite, share screen. We did this yesterday. Let's do this way. Share. So, do you have my PowerPoint file in front of you? Can you see my slide?
Yes, we're all muted, but we can see it.
Okay, perfect. All right. So I'd like to talk about corona and at home, and where does pain come from, how to prevent the soreness and stiffness when you're sitting around too much. And I don't know how many of you are still working. My office is still open, but a lot of our patients are sitting around. How to reduce the soreness and stiffness from lack of regular body work, because now we can't go get a massage. And then lastly, the cough was appropriate. How do we fortify our immune system? Because I'm one of those who's sane enough to believe that we're all going to be exposed and we're all going to have an opportunity to come down with this virus. And whether we win or survive at the end of this is going to be what our immune system does to us when we have that exposure. I think it's probably not realistic to plan on avoiding it. Those are my kids. The one on the left has already gotten the virus. He's in New York. He survived. He's doing well. One on the right's in Seattle, the other hot spot in the country. A lot of these slides came from a talk, how our bodies are put together, what really causes pain. We've looked, and this is the URL for this video that I'm about to show you on fascia, and let's see how this works. Whoops, wasn't supposed to do that. Okay. One more time. Maybe this time I won't touch it and try to hurry it up.
We would like to present a unique aspect of the human body that has, until now, received little attention. This tissue is similar to a net like this one, which wraps all of the organs and muscles. Using a special camera, a French surgeon was able to capture this tissue on film. Until today, it was thought of as merely being kind of a packaging material, but recent scientific research has surprisingly shown that it can also be a source of pain in the body. Butchers cut off this tendinous wrapping tissue, the role of which in the animal body as well as the human body has been underappreciated. This small wonder is called fascia, and it's what holds us together. A connective tissue system that is now catching interest from scientists. It plays a crucial role in muscular force transmission and is a sensory organ, actually our richest and most important in terms of body perception, and thus it can even lead to bodily dysfunction and to chronic pain. Even when removed from the body, fascia has been shown to have the capacity to contract and relax independently. For scientists at the University of Ulm in southern Germany, this is a strong indication that tension and pain can originate in the fascia. The fascial network wraps all of our muscles and organs and participates in every body movement. It contains nerves and blood vessels. In addition, fluid circulates through the tissue, giving the entire network the capacity to function hydraulically. The fascia can form adhesions, develop perforations, and produce complex tissue contractures. And that's where we are looking for ways to restore fascial functioning, as for example, with manual bodywork. How can we get a tight fascia to relax again? As the world of the fascia begins just below the surface of the skin, this network can be manipulated from outside the body. The Rolfing method of structural integration is a kind of fascial bodywork which is, for example, used to address neck and shoulder problems along with a number of other physical complaints. It often helps with musculoskeletal disorders that go along with tissue hardening or stiffening, as well as the subjective sensation of being somehow physically jammed or stuck. Rolfing practitioners use manual techniques to improve the function of fascia. They are experts in working with this unique system in our bodies.
So what we've found in our research in the last 30 years is that pretty much all pain in the body is coming from the fascia, and we'll talk a little bit more about that later. Let's talk about some analogies. What would you do if your finger was bleeding? Would you hold it up in the air and watch it for a while, take some ibuprofen, see how it is in the morning, run to the emergency room because this could be a travesty, or obviously put some pressure on the little cut and you'd stop the bleeding? And now what if it was back pain or you hurt your foot? Would you hold it up in the air and watch it for a while? Would you take some ibuprofen, see how it is in the morning? Or what if you could put some pressure, figure out where the pain was coming from and stop the pain just like you could stop the bleeding? And for many of our pain syndromes, there's a lot we can do that will do just like that for our bodies. When we talk about chronic pain in the universe and what the world is taught, what we find is that we all agree there's an acute injury. We all agree that that brings us pain. And then if that pain isn't gone in 3 to maybe 6 months, depending on who you read and what you measure, then we find that it magically turns into chronic pain, which is an entity that we have no hope. We can't make it go away. We have to kill the nerve, interrupt the signal, do epidural steroids, make the nervous system not work with medication and TENS units. Pretty much a kind of a dismal view. And that's not our biologic reality. That's just the reality of what we teach in medicine and public schools. The reality of our biology is that you do have an injury, the injury gives you pain, but that pain will continue until you heal from that injury, and then the pain should go away. And it doesn't matter how many years that takes, how many weeks that takes, everybody still has the capacity to do that. And I would say pretty safely, that's about 90% of the time. There's a few we have difficulty figuring out. This is another video. This is one of my patients in New York.
Well, this has been quite an experience. I'm actually a little bit in shock. I've dealt with back issues almost my entire life, starting with scoliosis. And I thought that pain was something I was just going to have to live with. And so now that I have issues with my shoulder, it's gotten so much worse. I thought I had to try something different. And now that I saw Dr. Blatman, I'm quite in shock. I've learned that pain is not what I thought it was. and the way you treat it is not the way that I've been treating it. So now I'm excited because now I can't wait to see how much better my body's going to get.
So where does pain really come from? And I've distilled the CSI of pain into 5 rules. Rule number 1, you as the patient can't believe the pain really comes from where you feel it. Your headache does not come from your head. The pain in your left arm could be a heart attack. The pain in your knee doesn't mostly even come from the joint. And the best proof of that are the people that you know who've had their knee replaced and the knee still hurts and there's no knee there to cause pain. Rule number 2, contrary to what we were taught in school, it's not important what you think the pain feels like. The brain can't tell the difference between numbness, tingling, burning, itch, tickle, sharp, dull, achy, stabbing. All that information we spend so much time listening to and thinking about really isn't important and is not diagnostic in any way, except sometimes. Rule number 3, if you can't believe where you think you feel it, and you can't believe what you think it feels like, what can you believe? And that is, the only thing you can believe is that where your biology is specifically tender, millimeter by millimeter as it gets touched, that you can believe. And the places where you're tender are where the fascia connects and holds you together in a weave to your periosteum, which is also fascia, or where the fascia is kinked as a result of the interruption to that weave and to the strings between the weave and the kink. And you wind that kink up by your muscles, and that kink we call a trigger point. Number 4, the most tender areas as we do that exam represent the injuries through your lifetime that cause most of the pain that you have come to the doctor for. And rule number 5, no matter how long you've had that pain, if you get these sites of injury to heal, most of that pain will go away. And these injuries can't be seen on an X-ray or an MRI scan. So when I do a physical examination, it's not me examining you, it's you and me examining your biology. And the first part of the exercise, or one of the things to define, is, can I feel on my side of your skin the same thing you feel on your side of your skin at the same time? And most all the time, that's going to be true. And so as I touch you, I will know where you're tender by the texture of your fascia. You guys will get to try that on your own bodies in just a few minutes. So there's a couple books you can read. The first book on fascia was published in 2012. This is its reference. Robert Schlepp, who you saw in that video, is one of the main authors of this book. And David Lasondak, the fellow who filmed the videos you're about to see, wrote this, which is kind of the Cliff Notes version and updates you on what has been discovered since 2012. This book is already 2 years old. Fascia has many forms. It holds us together. And the world recognizes this piece of anatomy trains. You have fascia lines that go through your body and connect you from head to toe. And if that fascia gets stuck somewhere in the middle, you have a discoordination. So if you can't throw a ball and make your body look like it's a unit with both hands, then you have a fascia disconnect on one side or the other that doesn't let your body flow. And you all recognize people who can dance and move and people who can't. And you recognize people who are more coordinated and people who are less. All of proprioception comes from fascia. And some of that is through the skin and the fascia of the skin. And fascia has many forms, and these forms vary by function, where the function is to give you lots of biofeedback and proprioception, like your legs, the fascia is relatively tight. Where the fascia needs to give you different kinds of information, it will have a different texture. And we call this also soft tissue. So those of you who have seen TMJ syndromes, and those of you who have seen jaw pain and head and neck pain that starts 10 years after a cervical motor vehicle accident injury, this is what that's all about. That's all. It's not such soft tissue, it's just soft because it doesn't have bone. It's really the primary injury that didn't heal, that still needs to heal, that's causing you your pain. So Tom Myers did the dissections, and these dissections are called fascia sparing dissection. You can order them yourself from anatomytrains.com. And this is the superficial back line. If you'd like to feel this in your own body, put a little stretch on your hamstring so it's significant enough you can feel one or the other. And then two things one at a time. One, take your pointed toes and dorsiflex your ankle, and you're going to feel it bigger in your hamstring. And two, tilt your neck, flex your chin down to your chest, and you're also going to feel it bigger in your hamstring. And you've just felt what's called the superficial back line of fascia. Enjoy this video. You might turn your sound down. So you can see the heel cord, the plantar fascia. You can see that this goes to the gastrocs. Look at the gastroc and the hamstring. They're tied together. You can't separate them. They're almost one muscle or fascia. They just weave into the back of the bone. In this patient, the hamstrings are tied together. This person would be coordinated differently if those two hamstrings were not. This is the sacrotuberous ligament, the lumbodorsal fascia, multifida muscle of the spine. That's the cervical spine muscles. And then you see the yellow, which is the galea that goes all the way up to the forehead. So what you felt when you did that, put tension on the hamstrings and then move the ankle and move the head, is you felt your superficial back line tighten, and your most sensitive spot happens to be your hamstring, and that's why you feel it there. In a similar fashion, there's a deep posterior line, there are deep and shallow front lines, side lines, and spiral lines up the middle. And we've learned about superficial fascia, deep fascia, endomysium. I'm not going to talk about those. I'd rather talk about these more important concepts of what does it mean when you put all those words together. And there are many types of collagen, way more than 12. And whether you glue your fascia together, as was spoken about in that first video, and whether you don't as you repair, actually depends significantly on what you eat. This is an electron micrograph of fascia strings through a ligament in a knee. It's artificially colored, but you can see the strands. Changes the fiber. Really delicate things that really strain your forearm, and you have all that biofeedback that really just tightens all these muscles. That's a repetitive strain injury. And that repetitive strain is going to increase IL-6 and other chemicals of inflammatory response. 90 seconds of osteopathic manipulation, myofascial release, maybe the raw thing, will not only relax the muscle and force the strings to unkink, it will change the physiology of the inflammatory chemistry within the fascia of the forearm that you spent the day straining. So it's not just feel good, this massage idea. This is actually changing the biochemistry in your tissue. So that gives us some idea that one massage therapist isn't going to get the same results as another massage therapist just by small variations in their technique. This is also important. You know how we send the average rotator cuff tendon person, we send you to the orthopedic surgeon, and they usually send you to physical therapy, and you spend a few months doing these rotation exercises with the bands on the wall. That can't strengthen a tendon. That can balance the muscles of the rotator cuff. But if that muscle can't anchor because the tendon is weak, you can only pull as hard as the weakest string in that anchor. And the anchor is not going to get stronger by pulling on it. Now, look at this slide, which we've been looking at for a number of years and never put two and two together, but it changes how I think about that whole piece. And that is, if you take a genetically engineered tendon, so you didn't have to take it out of a rabbit, and you can't really take them out of frogs, and you do myofascial release on that genetically engineered tendon, you will increase the tendon weight and increase the tendon strength. So rather than pulling on the tendon in physical therapy, you should be doing this myofascial release and rubbing on this tendon to get it stronger, which also happens to unkink it. So we've been doing that for about 6 months. And we've got some other things that we've been doing that actually change tendons and muscle in ways that I didn't even know 2 months ago. Maybe I'll talk about that at the end, please remind me. Fascia can alter the mechanics of the body. It can contract, just like it said in that video, and individual structures, some of them are just labels for areas that don't really deserve their own label. For example, there is no such thing as a medial collateral ligament of a knee. There's no such thing as a lateral collateral ligament of a knee. And if you do fascia-sparing dissection of those structures, you'll find that they were artificially cut out because the fibers go transverse, not just longitudinal. So it's really just a thickening of the joint capsule. And there's other examples. True ligaments are the anterior and posterior cruciates. That's a little bit different. So this is to remind me to tell you that you can see nerve in fascia and you can see muscle in fascia. And fascia has the ability to contract. And when fascia contracts, it's slowly over an hour to an hour and a half. And when it relaxes, it's the same hour to hour and a half. So when you've been carrying your book bag around for, half a day, and you put it all down and you realize your shoulders are sitting up here underneath your ears, that's because your fascia tightened, so your muscles don't have to do the work. And now you've got to loosen the fascia to get that back down. We do not know the buttons that make this tighten, and we really don't know the buttons that make it loosen. We do know that histamine has something to do with tightening, because if we put this muscle or this fascia in a bath and we drip histamine in it, it will contract. The buttons to loosen it are not quite identified, but we have found that an irreversible alpha blocker called I'll have to think about that. You can order it from a compounding pharmacy. You can put it on the places in your body that tend to tighten up through your workday. It's like you have armor all on. And you'll find that your muscles don't tighten to stress until you're stressed beyond what the medicine will do. And then you might need a second application in a day if you're a really stressed person. Examples of when fascia contracts pathologically: one is Dupuytren's contracture. And as a hand surgeon, we would do a complex incision and peel all that fascia out. Now, as a needle surgeon, I use a needle to release the fascia. You still have the cords, but not a tendon injury, not a nerve injury, and your post-op care is a handshake until recently. And we send you home without a bandage that is trying to keep you from bleeding on the inside and separating your skin, which is not a good result from that hand surgery. Got a couple other videos to show you. We all think that this string that is up here in the shoulder blade and runs up our neck and it attaches to the shoulder blade. I want to show you that nothing attaches to this shoulder blade. We call this the spiral line.
So I'm holding on to the rhomboids that have been resected from the spinous processes here. You can see the white division between rhomboid minor and rhomboid major, and you see the medial border of the scapula here. And if I let go of these rhomboids, you see how they are not really headed for the medial border of the scapula, but really sucked down into the serratus anterior. However, if I use them as a strap and put some tension on them, you see how they move that medial border of the scapula. And if we move the camera down to the ribs below the scapula, you see the serratus anterior being moved. Therefore, that Myers guy tends to talk about the rhomboserratus muscle as if this were one muscular sheet that's going across.
So, in truth, the scapula, its only attachment to your skeleton is your clavicle. And otherwise, it floats in a sea of fascia with no real attachment. Kind of a surprise. Certainly was to me. So, scoliosis comes from the same kind of idea. We get a scoliosis because a child's spine is supposed to grow vertically. And if the fascia either constricts and prevents that vertical growth, or doesn't constrict but just stays there and doesn't grow with you, then the spine grows in the path of least resistance, which is a spiral, and that's the spiral of scoliosis. So everybody's looks different, everybody happens differently, And the braces can't work because scoliosis is an inside job. You can't strengthen muscle to beat the tug of war of tightening fascia. So here's some details about scoliosis. Here's a picture of what it looks like. You can see over there on the right the rib deformity that creates the hump because the spine is rotated, it's not tilted. And we put rods into children so that their lungs aren't so compromised that they can't breathe, they get pneumonia and they die. And leg length discrepancy doesn't make a scoliosis. You have to have that twist in your spine. You can see this girl's hump is over on the right-hand side. I've even made some arrows so you can see it. And we have learned that we can feel the tight cords that bind the child, and we can do a needle surgery to release them. This is earlier work showing that we can release them and show the child will spring up, sometimes a ½ inch in a visit. There's my spring up arrows. This is an 11-year-old who grew up with no curve because we were able to find this and release her before she ever started to really grow. She had an angle and hump in the beginning, but that angle and hump were gone 2 years later. This is another girl. You can see before and after pictures how the shoulders up on top are much more tilted than the ones down on bottom. That's after a treatment. She did go on to surgery, but they didn't have to operate as much. And this is a real recent case, the best x-ray we've had to see. This is he was 13 years old a year ago. The school nurse noted scoliosis, sent the family doctor. The x-ray on the left was taken. No, I'm sorry. No x-rays were taken. And there was no follow-up arranged. Last summer, almost a year ago, the child told his mom his ribs were sticking out. She didn't pay any attention. And just this past December, this x-ray on the left was taken. And that was the scoliosis that appeared in a year. And at 50 degrees at the University of Houston, they operate on these. The father knew me, sent the child and mom. They spent 4 days in our clinic. And at the end of that, we have the x-ray on the right, which is markedly changed just by releasing his strings and then showing him what to do at home. When we talk about sensory parts of the muscle and the fascia, when we were in medical school, and I would assume the same for dental school, we were taught about Golgi tendon organs and pisciform endings and Ruffini endings, and we were taught that that's most of the information that comes to the brain from the fascia and the periphery. Well, truth be told, that's less than 20%. If you look at the tibial nerve, there are 3 times more sensory fibers than motor fibers, and only 20% of those fibers come from the mechanoreceptors of Golgi, Pacini, and Ruffini. 80% of your sensory information are small diameter interstitial muscle and fascia receptors, and 90% of them are unmyelinated free nerve endings, some for pain, heat, chemicals, but most measure pressure and shear force. And that is where proprioception and pain come from. So roughly 80% of the information that comes to your brain from your periphery are unmyelinated free nerve endings that are part of the sympathetic and autonomic nervous system and integrate directly with your immune system. And the 3 of them dance very well together until you have chronic pain. So here's a diagram of the strings of fascia through any muscle in your body or through the covering of your gallbladder, for example. And here's a picture of the unmyelinated free nerve endings in between these. And as these strings move, these nerve endings sense the shear. And if these strings compress, they sense the compression. And with too much friction and too much inflammatory reaction from food, they start to light up, and they light up more and more. And that's where the pain, most of our bodies, comes from. We look at proprioception, we look at a baby, their hands are all over, their legs are all over, they don't know where their bodies are in any of this.
You do all kinds of funny things.
And they're trying to figure out where their arms and hands are. And when they start and they first hold a spoon in their mouth, they can grab the spoon and they try to put it in their mouth, they go too far and hurt themselves. So as their brain learns to integrate the area under the curve of how these strings move and the nerves in between that I just talking about that get torqued and twisted, that's proprioception. And if that fascia is bound anywhere and tight anywhere, you've lost some degree of proprioception. So no matter what body work you do in treatment of pain, whether you call it TMJ and migraine or headache or foot pain, they're all coming from the same origin. They're just different places in your body. And your biggest clue to the source of the origin isn't where you feel it. It's where are you specifically tender. So you can't believe where you hurt. You can't believe what you think the pain feels like. You can only believe where you're tender. And specifically where you're tender is where your fascia strings are kinked or where they attach and weave to you and you've injured them. So we call this myofascial pain. All these knots generate pain not only where they are, they refer pain along the fascia lines. And now it makes a lot more sense because it's not about dermatomes. This is a flip chart you might have in your office. I've put lots of these in here. Any of these muscles, any of these attachments can have this injury. And it doesn't have to be a muscle. It can be a ligament. It can be a tendon. It doesn't matter whether you call it migraine tension or TMJ syndrome. They're all basically the same thing with just different muscles involved, unless you have the joints involved. So let's look at the sternocleidomastoid muscle. The injuries are where these circles are. So take your hand, put your index finger in front, your thumb behind, grab a big piece of your sternocleidomastoid muscle and feel for some tender ropes and cords on the inside, and you felt what we're talking about. Now feel the next one. Take your finger along the top of your collarbone and feel where that's very specifically tender. There are places where it's not, and you'll come in closer to the middle, and you'll find some places that make you kind of shake your head and get startled a bit. Well, the place you touched down here is the injury. How did you get it? You know, you were minding your own business in nursery school, paying not attention to anything. It was another happy day like all other days in nursery school, but you pissed off Sally when you walked in the door because your lunchbox clashed with hers. And right before recess, she came up behind you and you had no idea and did this to the back of your shoulders and snapped your head back. And you tore this string and you wear it in this knot for the rest of your life, perhaps causing you these migraine headaches. And nobody knew. Headaches do not come from your head. And if the one on the right is more tender than the one on the left, you have a more serious injury on the right. Or maybe you were injured there more times. But at the end of the day, it doesn't really matter. The result is you have more pain coming from the tender one than from the non-tender one. More pain from the tender one than the non-tender one. And you don't get these without getting them. You guys already know that. You can feel it like we did by grasping and pinching. This is the picture of what it looks like, what you should all have just done. This is what it looks like if you do it to the person sitting next to you. And I'm going to skip through these because you can come back and look at them. This is just diagrams of where is the focus of pain from where the knots are. This is showing you where the injuries are. We all have these ropes in the top of our shoulders. Where did that come from? Well, you carried around this book bag for a number of years. And you're strong enough to contract this muscle to lift that heavy suitcase and to bench press 500 pounds. Where you anchor and hold together isn't strong enough when you pull that hard, and that slips the same way, and you twist into these knots, and they're not any different. Again, not any different. If you touch your hand to these parts of your clavicle, you can find where that's really tender. And not only can you find it, you will soon appreciate there's a difference in texture between the places that are really tender and the places that are not. And if you can master that difference in texture, which is what we teach in our workshops, then you can tell another person where they hurt and where they're tender without them having to tell you, just by the texture of what you feel. Just more pictures of headaches. An upper extremity isn't any different. Is it any wonder when the scalene trigger points send pain or numbness down to that distribution in the hand that one could think that a cervical adjustment would change carpal tunnel syndrome? And it actually may, because it also changes the fascia, because you cannot change the neck without changing the hand. The infraspinatus muscle is the cornerstone for all pain in the body above the level of the bra strap. Remember that. So when you work on your body because your head and your neck are tight, and I show you how to use the ball in a video that's coming up, this muscle is key for all pain from the bra strap up, including the little finger of the hand. This is the one when you throw a football too hard and you forgot to warm up. Appreciate, this is a way to palpate the biceps, and you want to palpate all levels of a biceps as well as all levels of a triceps. This is to help drive home the point that if you have a person who's got a tremendously painful shoulder and there's nothing you can do about the shoulder with your skill set and your ability to recommend, but you can touch this triceps and it's exquisitely tender. If you can modify the trigger point in the triceps, you're going to change the shoulder pain without ever doing anything to the shoulder. And how to palpate the triceps. Latissimus, part of the muscles that you saw on that video, this is where pleurisy comes from. Pleurisy is not about inflammation between the lining of the lung and the lining of the chest. Because for the last 25 years, every case of pleurisy that I've seen, you put a needle into this muscle, you make that pleurisy go away. And there have not been any exceptions. You guys all have this one. And here's how you touch it and feel it. And that's right where the most tender place should be. Lower back pain doesn't generally come from the lower back. The lower back isn't the tender part. These injuries, where these green circles are, happened to you in childhood. Yeah? Jumping out of trees, jumping off the swing set, jumping down the monkey bars, and you were either the child that led the other kids, watched the other kids, or followed the other kids off the roof. You'd be amazed how many people remember jumping off the roof, except the person who said, no, it was a hay loft, and I was really surprised the hay was not as soft as I thought it was going to be when I hit the bottom. So the gluteal muscles cause most of the serious lower back pain. The injuries come from childhood, plus the one that broke the camel's back that you thought was in your lower back when the disc went, and the disc had nothing to do with the pain you still suffer from. So when you learn how to use the ball, everything of significance within reason, from your lower back to your toes, comes from your butt first. So if you just get your shoulder blades with this ball and your butt with this ball, you've done a lot to treat a fair amount of your entire body. And if that's all you do walking from room to room in your practice and that's all you have time for, you're going to feel a whole lot better at the end of your week having done it than not. Pelvic pain, not any different. And it's not just the trigger points in the muscle. It's also, wow, it's not just the trigger points in the muscle. It's how this fascia all connects and holds on, which is where the injuries are. And the other side of this fascia is the hamstring and the adductors. So you can't even believe the pain in your bladder or your prostate. If you've been taking antibiotics for 9 or 12 months and they still think it's your prostate, it might be a good idea to touch the muscle on the inside of your thigh, give it a good hard squeeze, and just be surprised how tender it is. When people's pain makes their leg give out and we think it's the back, it's usually not. It's usually these tendons aren't strong enough to hold you up. And you pulled on the weakest string, the muscle shifted, kinked, and you going down. The reason you can't bend over and reach your toes is because your hamstrings are too tight, and that loosens the same way. You might think your foot pain comes from your foot because that's where you feel it, so you go to the podiatrist, but most of your foot pain comes from the back of your calf. And most of the pain that's called most of the pain that's called phantom limb pain is not phantom at all. It's not coming from a nerve, and you're not imagining your foot. The gastroc that's still in your stump still sends pain to your foot and doesn't care that there's no foot there. And just when you think you figured it out, the muscle in the calf sends pain to the face. So if you have a long time TMJ face pain patient They'll make movies about you if you touch the calf. So you have to send this person to someone who can. And I have found face pain coming from soleus. So when a person has a pain pattern, whether it's in the jaw or the head and the neck and wherever it is, it's not a solo artist. It's an ensemble or an orchestra of fascia contributing and sending the signal of kinks to that area. And then the immune system gets involved, mostly by our food, but also by environmental toxicity and poisons. So a lot of times people would come in and they go, my pain is worse. And I'd go, well, what have you done in the last 3 days that's overstressed your muscles? What's the weather going to do tomorrow? How well did you sleep last night? How much stress are you under? But most important, and dwarfing all of that, is what have you eaten in the last 4 months? Because if you wake up with a stiff neck in the morning, it did not come from the window. You did not sleep that long unless you ever lay down those. And it didn't come from the pillow. It came from the bread flour, sugar, and dairy you had the night before, possibly in the pizza.
Hi there. Today we're going to learn how to use this rubber ball, or a rubber ball about this size and about this texture. It's a super ball. It doesn't squish easily. It's relatively firm and it's rubberized so it sticks to you and sticks to the wall we're working on. We're going to use this ball to massage the muscles throughout our body, the muscles that we can't reach with our hands. Using this rubber ball, you can do a lot to massage your own body. Myofascial release makes some of your pain go away. I like to use this ball against the wall, and I can use this ball to reach parts of my body my hands can't get to. My shoulder blades, the muscles over them, and my gluteals, my buttocks, are the 4 most important areas in my body for generalized aches and pains. I start this by putting my butt right on the wall. I can take the ball up here, sit on top of my shoulder, and just by leaning forward little bits at a time, I can drop that ball down and send it exactly where I want it to go. If your butt's not on the wall and you try to do that, you'll be trying to keep the ball from landing on the floor. So secret, butt on the wall, drop this ball down. I send it down to my bra strap. That's a good general place to go. Then stand off the wall, move your feet, maybe a foot, 1.5 feet from the wall. And then you can go up and down, covering this muscle between your shoulder blade and your spine. And I like to do this limbo. Get your belly going out, your knees going out, tilt your head back, and you can get across the upper traps just like that. And you can even just keep going like this. And that covers the muscle from your shoulder blade all the way down to about the tip of my thumb without having to go up and down and use your knees. The ball is on my paraspinal muscles, left or right next to my spine. Right now I've got them on that side. You can go up and down for your paraspinal muscles. You can go back and forth like this for your paraspinal muscles. But the most fun is to limbo. Put your belly out, bend your knees a little bit, and come all the way up here to your upper traps, and you can massage them. And you can also do this action and massage this piece that's right up here that bothers so much of us. This now on your shoulder blade. So you'll turn about 45 degrees to the wall, cross your arms and tuck them in. If your arms are hanging down, you're going to be doing this when you rotate. If your arms are like this, your shoulders are going to be elevated and you'll be holding on. If your arms are tucked in like you're mad at me, then your shoulders will be relaxed and you'll be relatively calm. So now the ball goes on the shoulder blade, you're 45 degrees to the wall, and you're going to do this wiggle dance right on that muscle that hurts. Bend your knees to get the upper part, straighten up to get the lower part, cross lightly over the middle. The ball always drifts up, so adjust it back down. Do this limbo thing to start getting the other side, and then turn 45 degrees and get this shoulder blade. Now you can do your paraspinal muscles all the way down with some imagination, but the next really important spot is right down here. You're going to get mostly this outer part of your butt all the way up to the iliac crest, but not on the bone. And it's the same motion as what you used for the shoulder blade. You're just going to do this wiggle dance, bend down, come back up, and then cross over to the other side and do the same thing. And in just a few minutes, a few times a day, that's plenty long enough. You can certainly do it longer. Just using this ball, you can make a lot of your aches, pains, and soreness go away. There are two ways to go down the paraspinal muscles of your back. You can either drop the ball little bit by little bit and do like this, or you can go up and down little bit by little bit. You can do it either way. One of the easiest ways to hold the ball while you're doing this is to put it in pantyhose. Thin enough so that it doesn't insulate the force of the ball, and long enough and strong enough that you kind of have the ball on a rope instead of having to pick it up off the floor. The next part of my body I like to do is my gluteal areas. I've already spoken about how that's one of the 4 most important parts to do. And you're going to cover just about where your belt goes, all the way down to about here. You want to cover from this trochanter of your hip bone to the iliac crest and not be on either bone. It is not a good hurt when the ball goes over the bone. When the ball has no business being on the bone, it'll tend to bruise the bone, especially if you push hard, and you don't get any extra points for that. You really want to use this ball on the muscle belt. So you're going to turn 45 degrees to the wall, cross your arms again, and you're going to be doing this wiggle dance. Just this rotation. I don't care if your back hurts and you think this is where you belong. Over here is where the back pain comes from, and that's where it's important. If you use this ball on your sacrum and your lower back, it's going to make you uncomfortably sore and bruise your bones. And you'll find a knot right about there. You want to bend your knees and get the upper part, straighten your knees, get the lower part, rotate and cross slightly over this middle to get to the other half of your butt. And in just a few minutes, you can go from your shoulder blades to your butt, taking care of maybe 60% of the pain that goes all over your body at the source of where it really comes from. I'd like to show you how to use this ball to massage the muscles in the back of your neck. You will not be able to get to your neck with your body flat up against the wall. You will not be able to get to your neck with your body flat up against the wall.
That's for
You're going to have
emphasis.
to put your feet out and angle yourself. Your shoulder blades will be on the wall. The ball can then go right there on your back, and you can make little motions up and down like this. And then you can get to the other side and do the same thing. If this part of your arm is really bothering you, and these muscles are really tight, making pain in your elbow, pain goes down your forearm, the ball right here can make a big difference. So you turn into the wall, put the wall between the forearm and the ball, support your arm with the other hand, and then use your body as the push and rotate your body so the ball rolls right over that part of your forearm in this fashion.
All right. Hope that's helpful for all of you. We actually sell those balls in our office. You're welcome to get them from us, but it's a nice firm texture. We call that ball Mama Bear's ball. Baby Bear's ball would be a Nerf ball. Please don't waste your time with that. And Papa Bear's ball is a lacrosse ball. So if you're already on lacrosse balls and you already know about this, you don't need to get that ball. That ball's a little bit smaller, a little bit softer, sticks to the wall really well. So a brief review of inflammatory food. And this list has new meaning because of today. It's basically going to be anything your body sees and can turn into sugar. Wheat, sugar, potatoes, fruit juice, artificial sweeteners, those are poison, not sugar, and hydrogenated or fake fat. Cool Whip, Miracle Whip, Crisco, vegetable oil, those are things to stay away from. And we've spoken to patients about this for many years, but it takes on a more critical role right now. And the critical role that we see is that younger people are dying in this country more than the older people from this coronavirus. And I would think it's because of what they eat, drink, and smoke. So if your immune system, when you eat these foods, your immune system is not going to be as active for several hours. They're not really your friend at this point. So talk about fascia shear. Where do trigger points come from? If you examine and you look at ropey bands, you will see that every ropey band in the body has a tender end. And the more tender, the more injured. So if the muscle is going to pull, this is what PowerPoint does to Keynote, and pulls a little further, you can see the torque and the twist, which makes the shear force that brings on the trigger point. And that's where this comes from. The injury is the white circle. pain is the red circle. And you can palpate both textures and learn their difference. Same thing with a tendon. Tendon gets sheared and stressed. Parts of the tendon tear and give up. The shear force, when it gets big enough, creates pain. And you can also palpate both textures. You can feel this in the masseter. You can feel it inside when you examine the pterogolds. So here's a patient with tremendous pain in many parts of her body. We identified where the injuries were. We did a platelet-rich plasma injection series, and when you have platelet-rich plasma, you're taking the body where it can make a scab, and you're using the material that would make that scab by taking it out of their body, and you put it into the injury that you just created, and people will grow a new tendon. You guys probably already know a lot about this, but I want to show you what happens to this woman with what we do for her with this pain. And we injected all these spots. We actually get 6 spots out of a dose of platelet-rich plasma. And this is her pain a month later. She's tremendously better. And you can see from upper left to down center, 3 months following that treatment. She can injure herself and bring her pain back, but this kind of proves the point that the pain's coming from the fascia. So let me come away from the slideshow and look and see where I want to go from here, because that's the nuts and bolts about the fascia. I want to show you this from current slide. Cool. So this shows the fascia weave of the enthesis over on the right and the muscle fibers. And as you pull on that, you end up with a slip from the muscle contraction or sudden landing. The fibers tend to rope into this knot, especially if your diet is such that you're making scar tissue instead of letting it go. Now you have a ropey band and a trigger point. That gets a little bit worse. And this trigger point starts to fire, make a lot of noise. And what is the significance of the ropey band? And we all have ropes in our muscles. And here is the point. The rope is dense enough that it inhibits blood flow. So now the muscle has a lower level of perfusion. And as a result of this lower level of perfusion, it's going to start to burn fuel anaerobically way before it should. And that's going to make it produce 32 molecules of lactic acid for every molecule of ATP it makes. And you don't have enough perfusion to wash the exhaust out of the muscle. So the muscle becomes toxic and also adds to the pain. So that's the significance of the ropey band. Let's divest ourselves just for a second. Let's look at edema in the leg. Why does somebody have peripheral edema? Why does their leg swell? Why does an ankle swell after an ankle sprain or an injury? And the answer is, when you look at someone with swollen legs and lymphedema, and it's not their heart, and we were always taught the venous insufficiency, but the gastrocs have been really, really tight for a long time. And they've been doing this thing with metabolism and not being able to detoxify because they don't have enough circulation because the ropes are too tight. And the fibroblast senses all of that toxicity, and the tentacles at the end unhook, and the fibroblasts separate and suck water out of the veins. That's why you get swelling from an ankle sprain, and that's why you get lymphedema. If you want to make it go away, you have to detoxify the fascia and get blood flow back, and then you don't need the support hose anymore. Another significance of this ropey band is that your athlete is going to bonk more quickly. All right, so what do you do with that? Let's go to our next slide and talk about treatment. You inject gas into the ropey band. If you inject a liquid into the ropey band, when you touch a needle to the trigger point, you are going to release the fascia and the knot is going to go away. But you haven't really changed the integrity of the ropey band. And no matter how much fluid you force into that rope, you will not get that fascia to unstick. However, if you use a gas, you can force the fibers in that rope to separate, and you can restore circulation to the muscle almost immediately. Not only that, but the pain is coming from this kink, and you've just separated and allowed more of this fascia to flow. What you have not changed is the anchor in the tendon. And prolotherapy works faster than could possibly happen by the theoretical notion of scarring or the theoretical notion of rebuilding and regrowing tissue. There's no question that you do, but that needle also interrupts the strings and makes them more laminar. And as soon as you do that, you'll change the pain right where the needle came from, and you're putting the needle into the source and the injury. So not only ozone, separate the stuck muscle fibers, restore blood flow and perfusion, allow the muscle to detoxify, and the muscle restores, and you get pain relief. And then this fascia slip went away too fast. This fascia slip over here on the right-hand side, that has to be healed with a platelet-rich plasma and needle surgery, and then the muscle will come back to normal. So this is Andy.
I'm here with Randy. Randy has been injured several months ago, and we just did some treatment with trigger point injections. He's changed a lot of his food and diet to reduce inflammation in his body, and here's part of his story about his experience today. This is his second visit.
I've been suffering for the last 6 months with major arm pain, pins and needles running up and down my right arm. I've just had 2 or 3 injections, and I am pain-free right now. It's amazing.
And the numbness in your arm?
My numbness is, I can move my arm, there's no pins and needles. I can move my neck.
So we found that this pain is not coming from a disc and not coming from a nerve? And
no.
Numbness doesn't come from nerve necessarily.
And no one was able to do this for me.
So there's also the relationship of pain and stress. I'd like to spend just a couple minutes on that. In the 1990s, this study was done. You take a EMG electrode and put it into normal muscle, and the result is flatline. You put that EMG electrode into the trigger point 1/4 of an inch or 1/8 of an inch away, and there's spontaneous electrical activity. You have researcher and you have subject, put electrode in trigger point with activity, electrode in muscle with no activity, give this person a massage tape and relaxation, and the one in the trigger point calms down. So now you know that meditation, you see evidence how it can change pain. And then stress this person. They had him count backwards by 7 from 900. She got the first one wrong, and then they badgered her and asked her if she was stupid because she couldn't go any faster. And this is what happened to her. And that's what happens to our biology with stress and with tension. It increases our pain. And as we get more stressed, the effects of our sympathetic nervous system actually increase, and we exploit that. So let's go on to this virus and what we're doing about it. And that was stem cells and bones. I wasn't going to talk about that. Sorry. Right before stem cells and bones. Here we go. Boost the immune system. So if you accept the idea that you have a pretty strong possibility of being exposed, you want to do something that is going to help you handle that exposure. One is the echinacea. And the echinacea from Standard Process has been shown to improve T cell function increasingly over a few months. So not just take it when it's sick. I would start it a month ago and keep taking it through this entire episode. Vitamin C and the ester C may work better, between 500 and 1,000 milligrams 4 times a day. Andrographis, and I'm using Andrographis complex from Standard Process, twice a day as a prophylactic, and if I get sick, I'll take a whole lot more of it. That may actually kill the virus. Wellness Formula is a product that you can get from the health food store or online. Large, foul-smelling horse pills with a ton of ingredients to fortify your immune system. I've always used it for an upper respiratory virus and even bacterial infections. We all want our vitamin D to be up, so hopefully yours is already up around 80. Were you going to use silver? We can use it orally, intranasally, around your eyes, and intravenously. We do major autohemotherapy with ozonated oxygen. We also have recently taken on ultraviolet blood irradiation. Those are remarkable for all these infections. And most significant, this do not eat list. I'd stay away from everything that made my body think it was sugar, including alcohol. None of them are going to be a good idea if you really take this virus on. And hydrofluoric acid. If you don't already know about it, it's very inexpensive to make. It kills virus within 2 minutes on contact. You can spray it on any surface. You can spray it in your face. You can spray it in your eyes. You can spray it on your clothes. It's actually a chlorine that your body makes that your white cells use to kill things. You can make it in your own office. The equipment is really inexpensive. The supplies are really inexpensive. I spray it on my hands. I spray it on everything that we buy from the store. I spray it on the furniture when the patients leave. This is our predominant, probably best thing for infectious control. We've sprayed ozone, ozonated water, I mean, but this is actually proven it's hydrofluoric acid. So let's open this up for questions. That's really the material I wanted to cover and make sure to do. How do I get away from share screen?
How, you want to tell us
Yes.
how you make the hydrofluoric acid?
I bought something. I went online, looked up hydrofluoric acid, and made a purchase. Do I push escape? Here we go, stop share. There we go. So I bought this kit. One of them was $80. It came the end of last week. There's 2 more that I've got ordered that haven't come yet. It costs $1 to make a pitcher full that'll last for 3 weeks if it takes you that long to use it up. So it retains its potency. And it smells like chlorine, but OSHA says that it's actually safe to expose somebody to in a small room for 8 hours. So that tells me it's pretty safe to use.
Anybody have any questions for Hal about what he talked about and all the fascia, all those knots that we get that we can either pay somebody to massage out or use a ball to try to get out yourself?
I have a quick question. Can you clarify, is it hydrochloric acid or
Hydrofluoric. Actually, yeah, that's really interesting. I'm going to have to check that out real quick because that's what I remember. Because I kept thinking hydrochloric, but that's not where HYDROFL. There's no fluoride in it.
I know that I use hydrochloric acid in my office, and what you're describing is exactly, it's very biologically compatible cleaner, but I wasn't.
I think hydrochlorous. Yes, it's got to be hydrochlorous because it's chlorine. It's not fluorine. So thank you.
Mm-hmm. And there's a product commercially available too in big gallon jugs called Nixol, which is actually made in Nixa, Missouri. That's where they get the name, but that's just one brand name that I'm aware of that's already commercially prepared and it's ready to go. But I'm really interested in hearing more about the kit and how to make it. I don't care to comment more about that.
You plug it in and you push a button after you add the stuff to the water. It was really that simple. And I don't understand the process. But it runs on electricity and you plug it into the wall and you add the stuff that they tell you to add and it does what it's supposed to do.
Thank you. Is that a kit that you found on Amazon or did you go? Great. Thank you so much.
You're very welcome. Other questions? Don, your mouth is moving, but you're muted.
South, can you hear me?
Now I can.
Okay. Well, I was having a good time. I want to thank everybody who was on this evening. This was recorded, so we can go ahead and have this up by tomorrow in case you want to go back through and look at his slides. If there's no other questions, then I'm going to go ahead and stop the recording for tonight. And Hal, again, I want to say thank you.
And thank you all for being here. And let's all stay healthy.
Thank you.
Good night.